I'm based just down the road at UCL, and thanks for inviting me along today. I guess I'm going to set a timer to make sure I keep to time. But as Hannah said, I'm going to present some research and some ideas about healthy urbanism. And in some ways, what I'm presenting, and I explained to Hannah before, is quite a lot of like conceptual ideas of thinking about how do we think about the built environment, how can we integrate health and well-being into urban design and planning, and show you a few case studies as well, internationally, of development projects that have tried to do that. And I believe I've been invited because Matthew on the call was one of my past students. So I teach a module here at UCL which is called Health and Wellbeing in Cities. And what it does, it's a master's course, and the module I teach on brings together lots of different topics about different determinants of health that influence our health and well-being, and we together look at those different determinants and think about the connections and, as Hannah said, the interdependencies between them. And a lot of my work actually is, I'm a researcher, but a lot of my work is quite practice based. So I consider myself an engaged researcher. So a lot of my work actually falls in the boundaries between research and practice. So I do a lot of work with policymakers or with community groups around the ideas of health and well-being, and a thread that runs through my work is about bringing different knowledges together, because I do think that with topics such as health and well-being, it is about different forms and different types of knowledge, different disciplines coming together to try and tackle solutions, and so I find that aspect really fascinating. And as Matthew probably can say, like, a lot of my module brings in different speakers and also brings in different forms of knowledge, not just from the academic realm, but from practitioners such as yourself, but also lived experience and experiential knowledge to try and come up with solutions around health and well-being. So in a classic academic style, I do have slides, but I will try and keep to half an hour. And yes, I should say the other thing in my work is I'm going to present work from across my department, but also with other studies and case studies as well. But if there's anything that you want to get in touch afterwards, or particular idea you want to follow up, I think the other thing I do here at UCL is I'm a bit of a broker, because I access different researchers and different research projects. So if you have any questions or anything specific, then please do follow up with me afterwards. I'll be more than happy to connect you with somebody or have a further conversation. So this is very much an opener. So I'm going to start now. And so as Hannah mentioned, my talk is very much about thinking about health and well-being in cities and neighbourhoods, and I'm bringing together some ideas around theory and practice. And so what I'm going to do today is share with you a bit of an understanding about the factors in our cities and neighbourhood that affect our health and well-being, and introduce a theoretical framework, a conceptual framework, which tries to bring together those ideas and I guess give a bit of a steer about things that need to be considered and the connections between these factors to implement healthy urban developments. And that framework's called Thrives, and I'm going to talk through some other frameworks that I'll introduce you to, and then I'm going to outline some case studies as well from practice of built environment projects, and some of these you might be familiar with, to think about how do they fit within this conceptual framework. So it's quite big picture stuff, and my background's actually in geography, so I'm a social scientist and I do a lot of quantitative research. So I'm going to bring in some of those ideas as well. So yeah, the concept of healthy urban development, as many of you might be aware in your work, there is a bit of a resurgence of interest in thinking about developments, be that buildings or neighbourhoods or cities, and thinking about this idea of incorporating health and well-being. So there's lots of standards and guidance documents that are emerging, things like BREEAM or the WELL standard, that is trying to influence practice and give a steer towards practice to create environments and buildings that meet the agenda of being healthy. So that's sort of, I want to give the sort of why this matters context before I go into the framework. And similarly, and as Hannah mentioned, there's emerging policy programmes like the GLA, Designing London's Recovery, the Future Neighbourhoods programme, that are trying to, I guess, bring about change in cities and neighbourhoods to create this idea of healthy communities and sustainable communities, tackling lots of different issues. So there's a resurgence in standards, guidance and policy programmes for this kind of mission that we should work towards. But as many of you know, there's a bit of a jump between, I guess, principles that are included in guidance or ideas included in policy and actual practice. And there can be a difference between our idealised practice and the actual practice of what ends up happening on the ground. And there can also be challenges applying certain principles into context or situations. And I guess this is the link between theory and practice. I think the other aspect of it, which I find really fascinating, and I have done some studies working with different built environment professionals that try to implement sustainability and healthy projects. And what's really interesting is, I guess, the ideas that underline their practices can be really different to what's implicit in what they actually do, and they have implicit understandings of some things they're not even aware of that they're translating into practice. So they can start off with this ambition, but it can be really, really hard to put some of these ideas into their work. And I'm going to show a bit of that later with some of the case studies, and show some of the strengths and challenges with the case studies. And as I mentioned before, like a lot of my work looks at health and well-being in the built environment, and I think the thing that I find fascinating is this cross-disciplinary subject, and the fact that I think to achieve any of these goals is about bringing together different knowledges and different disciplinary knowledges and professional knowledges to try to work together. And I think that aspect is really fascinating. And I also think that what we can't do is work in silos. So actually we have to work together to try and tackle some of those issues around health and sustainability. And I think the other aspect of it that I find, and this comes up in some of the case studies that I'll look at later, is this idea of taking risks and piloting ideas. So trying to be innovative and creative, which does require kind of a shift in, I guess, our comfort zone and our skill sets and knowledges, particularly both within research and practice. So I just wanted to put those up at the start of why this matters, so why I'm talking to you about this today, and hopefully that might resonate with some of the work that you do in trying to work with different departments across the local authority, take risks with pilot projects, and try and embed some of your ambitious ideas that you have around sustainability and health in practice. So before I move on and talk about the conceptual framework, the Thrives framework, which I worked on with a colleague here at UCL called Helen Pignot, I thought I'd just start off with why does it matter? Why does health and wellbeing in our cities and neighbourhoods matter? And I guess the first point is that there's more people living in cities now than ever before, and it's an increasing trend. So over half the world's populations live in cities, live in urban areas, and the projected number is intended to rise as time goes on. And so there's also ideas around the fact that there's well, theoretically, there's meant to be an urban advantage of living in cities, so a health advantage of living in cities, which encapsulates the idea that there's a health benefit of living in dense urban areas compared to rural areas, about access to services and quality of life. But the urban advantage itself actually masks lots of the differences and the diversities of health outcomes that actually exist within cities. And I'm going to come on to ideas around health inequality in a minute, but there can be a burden actually of disease for particular parts of the population in urban areas, particular social and economic groups. So the urban advantage itself as a concept has been widely debated. So if you look at urban areas at a top scale level, there might be some advantage, but in some ways that highlights clear differences in the health of population within cities. Another aspect of why I think we look at cities, and there's a bit of a focus on cities and neighbourhoods and urban neighbourhoods, is that cities are complex systems, and I guess a quite lovely academic example of looking at how the interconnected elements of a system influences our health and well-being. And I think the other reason why health and well-being in our neighbourhoods matter is around thinking about some of the data around the impact of the environment on our health. And the World Health Organization estimates that the environmental burden of disease in the pan-European region is around 15 to 20%, and is around additional 20% of actually having disability adjusted life years. And so that's kind of why there's a bit of a resurgence and focus on thinking about urban environments and how they impact upon us. But the other thing to point out is that there are gaps in our understanding, that we don't have all the answers. There isn't one way to measure this or one way to monitor it. So there's, in some ways, research and practice is happening both at the same time in this area. And another aspect of that is, as I mentioned before, there can be real discrepancies between looking at these issues at different scales. So within neighbourhoods, there's clear differences. Within populations living in the same neighbourhood, there can be massive differences in health and well-being. And so there's a lot of challenges actually in trying to understand and assess what's actually happening on the ground. And I guess the current situation, one of the things that has been exacerbated by the current situation and COVID, and thinking about COVID and it's affecting the built environment, there has been evidence around higher death rates associated with environmental issues, so associated in neighbourhoods with poor quality air pollution, poor housing, and housing where there's been overcrowding. So again, thinking about that environmental impact on our that links to a big issue around how there's systemic differences in our health experiences, and so Michael Marmot has campaigned about this in a lot of his work, and with the resurgence of the Marmot review, and that fundamentally highlights the issue about the social and environmental determinants that impact upon our health, and there can be a gradient in that, and how our environmental factors can build up against us, like the diagram about the health gradient, and how these factors can impact upon certain social and economic groups to have a negative impact upon our health and well-being. And so there's structural differences around health, and which challenges actually a lot of the dominant knowledge where we're thinking about that health is just an individual factor, but this is pointing out that actually it isn't just about our individual choices and individual lifestyles. There are social and economic factors outside our control that will influence our health experience. And so that relates to the aspect of health inequalities and how these inequalities are unjust and avoidable differences in the population. And that means a lot of research talks about how that actually it's unfair, it's unjust, it's avoidable, it's unnecessary. And actually these things also can be changed. So if we tackle the wider system, then we can change and improve health and well-being of certain populations who are affected by the impact upon their being. So I'm just very conscious of time, but I think my slides can be shared afterwards, and Hannah and Matthew have those. But just to highlight some of those links between the factors in our environment and the health and our health. And again, there's been a number of policies where so it's not a new idea, but there has been a resurgence lately. But there's a long history of health and well-being linked to sustainability policies and in there, right back from the Brundtland report and before. And in a lot of thinking around urban policy as well. So it's a core concept, but I would say certainly within the last 10 years, it's become a bit more of a resurgence in being really visible in policies and guidance and standards. And so when I've been talking about the environment and the social determinants that affect, or the factors that affect our health and well-being, we're talking about the factors that combine together to affect our health and the health of the communities that we live in. And so these include not just the physical environment, like access to clean water, clean air, access to green space, access to good quality housing. Other factors that influence our health are also the social factors. So thinking about the networks that we have around us, our sense of community, and also safety, how perceived safety in neighbourhoods. But as I mentioned before, the economic factors, so our income and social status, also have an impact upon our health outcomes. And so these wider determinants of health also link to that person's individual characteristics, so our gender and our genetics and our behaviours do influence our health, but the wider determinants are including the social, the physical and the economic. And I guess not to expect you to read the detail of that, but one way of trying to unpack that is, even if you take one particular health outcome, so this is a systems model, so using the methodology of systems dynamics and developing a causal loop diagram of the different factors that influence the health outcome of childhood obesity. And so what you can see on this diagram is that biology and our individual characteristics are sort of one aspect of the system. And so we have biology, we have our psychology, we have the food that we have intake, but our physical activity, the environment that we live in that influences how the physical activity will influence childhood obesity, as well as the societal influences and the food production. So I guess thinking about health outcomes in this way acknowledges those complexities of the different factors that are related that influence it. And as I say, this is just an example of obesity, and this can be done for lots of different health outcomes. And so I like this diagram because it does illustrate that complexity, because then you can think about where can there be interventions to try and change the system or shift the system to have an impact upon a particular health outcome. And I guess thinking about those connections between those factors and how they can be illustrated and acknowledged rather than a very messy causal loop diagram, academics and researchers have tried to visualize that in conceptual frameworks to help us understand those connections between the issues and things. So one you might have seen, and the two leading thinkers in this field are Hugh Barton and Marcus Grant, who developed this health settlement map to try and illustrate and visualize the link between the social, economic and physical factors in neighbourhoods that influence our health and well-being. So they put people at the centre, and round the edge they've put the social aspects, so our lifestyle, the community, our economic position, and then outside that the layers of the onion, as I call it, that you can peel away that influence us are the activities that we have, our amenities within the built environment, and the sort of wider ecosystem that it fits within. And the illustration tries to bring together those factors to highlight the layers that affect our health and well-being. And so other academics have produced similar diagrams, and Matthew would have seen this one, I think, every week in my lecture series, because we work through these different ideas. So this is another simple systems map that tries to actually unpack the causal pathways between particular factors and the particular types of health outcome. So rather than just saying they influence our health, but actually which factors maybe lean towards our mental health and well-being, which factors influence chronic disease, and which factors influence infectious disease or safety and injury and violence. So academics have tried to pull that apart, and more recently you may have come across BRE developed a similar model based on Yvonne Riding's work to talk about those pathways and the health outcomes that result from environmental factors. So the next slide is some work here at UCL. And so I had a secondment working with Helen Pignot, who developed the Thrive framework, which takes a lot of those ideas from Yvonne Riding, thinking about those as a system, takes ideas around Barton and Grant's health settlement map, but kind of reframes that in putting the planet as a centre, so putting sustainability and planetary health at the centre of this. So rather than the individual, the key focus is actually around thinking about the scale of development having wider impact. The other thing that the Thrive framework tries to do, so it brings in lots of those factors that I've mentioned already. So over in this corner here, if you can see my cursor, it talks about the some principles which are needed for any integration of health and well-being in a development or in a neighbourhood, which is sustainability, making sure it's equitable and inclusive. So it talks about those three principles. And it also highlights the scale aspect of it. And so you can't think about health outcomes just at the local scale. It's important to think about the wider inclusive system and the impact upon the planet. So the Thrive framework, developed by Helen, and which was informed by some interviews that me and Helen did, talking to practitioners working in this field, and we also tested it in practice with a. Oh, sorry, I've just moved out my thing. Let me just share my screen again. Hang on. Tech error. Okay, so yeah, we looked at it in practice following a particular development that had the ambitions of being healthy. But what the Thrive framework aims to get across is that there need to be shifts in thinking about health in the urban system, acknowledging that health impacts often occur away from a new development. So you have to think beyond the boundaries of that particular development or project to think about the ripple effect beyond. So which is why we've put in those layers around local, ecosystem and planetary to push that thinking beyond those localized health outcomes. The other aspect that's really strong in it, and that's sort of new way of thinking, is to really emphasize those structural barriers that might prevent healthy living for many people. So there needs to be targeted interventions and ensure that those processes are inclusive and have opportunities for engagement and varied opportunities of engagement, acknowledging their needs might be different across different populations. And the other aspect of it is that link between health and climate and sustainability, and how the environmental degradation now and the climate crisis will affect our health, and so there is that need for using sustainable design principles for health. And what Helen's created is this broad conceptual framework, and I'll talk about its application towards the end. And there's lots of in the development Helen brought in, and I think the paper is available, so if anyone wants to read the paper, you can access it, but I can also share it afterwards. But Helen's review brought in different frameworks that have tried to think about these connections between these factors. And there's some really great work out there, such as Public Health England's Spatial Planning for Health, that focuses on those particular parts of the Thrive framework and gives quite clear design principles of how that can be achieved in the built environment. But certainly the Thrive framework is more about this conceptual framework to bring people around the table, to try and break down those silos and bring together different knowledge to understand and think about how health can be integrated within one development or in a neighbourhood. So I've given sort of background of research in the field, but as I mentioned at the start, part of this is about thinking about research to practice. And so there's still big questions in practice, which is, I guess, around how do we implement some of these ideas? So what's the role of planning and design in delivering and achieving elements of health and well-being? Where do these impacts occur? Like, if we focus on the localized aspect, how can we understand those ripple effect impacts further along down the line? And also thinking about so this idea about like mitigation, of trying to mitigate any health outcomes, but how do we also adapt the built environment, so sometimes reducing activities that are considered unhealthy and trying to promote more civility, sustainability and well-being. So these are still key questions in practice which relate to sort of the implementation of these ideas. And so one of the things that Helen and I did was look at case studies, so actual developments, and we did a series of interviews internationally where we looked at projects, some of them building scale, some of them neighbourhood scale, where they had a clear ambition that mentioned health and well-being, and that includes the aspects of sustainability as well. So I'm gonna touch on a few of them, but I'm really conscious I've got about 5 minutes left, and I do want any questions, or if there's anything that anyone wants to follow up on, I can go into further detail. But the first project I was going to mention was part of the NHS Healthy New Towns initiative, which was one of, I think it was on my slide about policy and practice agendas that were trying to think about health and well-being. So the New Towns initiative, I think, was launched in 2015 or 16 and was funded by the NHS to think about how does the built environment affect our health and well-being, and what can we do about designing new places and new neighbourhoods to try and mitigate some of those negative health outcomes. And so I think there's 11 different new towns in the UK. There's one in London, towards London, which is Ebbsfleet. But the one I was going to just draw out today is the Barton Park example in Oxford, which was a mixed use development, which included new housing, but also retail and amenities, including a community centre and a new school. So quite a large scale development that had health and well-being as a key goal for the development. And there's this obviously beautiful, I'm a bit of a geek, but there's a really lovely logic model of how the team at the start tried to unpack those pathways to lead to that health outcome. So that was like before any development happened, sitting around with key stakeholders to try and think about those goals for the development and how it would lead to that big goal of being a healthy new town. So they included lots of improvements to the green infrastructure, so creating new and actually improving existing open spaces. There was investment into local services as well, and amenities to have a sort of social support around health and well-being, promotion of food and healthy nutrition. So it's all some social interventions as well as having some physical changes. And in terms of the housing, they followed the level 4 code for sustainable homes. And there was clear, if we think back to the Thrives framework, there were clear links to thinking about inclusive processes and equitable processes in the development. So one of the aspects of it was about thinking beyond. One of the things that Thrives encourages people to do is to think beyond the boundaries of the development. And I guess Barton Park was interesting because there was already an existing community there. And so time was spent to understand the needs of that community and actually build on the assets that they had already. So there's lots of really good work by the community engagement workers there, and they could find out what are the strengths of this community and where are their needs. So that identified funding for expanding the GP surgery, new sports facilities, and support for health and social care. So there was a whole program that linked to nutrition, as I mentioned. So that they weren't going in with a blank canvas. They actually built upon this sort of asset-based model to thinking about health and well-being of yeah, they also did, I guess, again, we find that interesting in terms of thinking about the baseline for health. So they could actually monitor and evaluate to see what difference it made by implementing these interventions and changes to see if there were any improvements in health. And this project is still ongoing. And so that helped again in terms of, again, understanding the context before making any changes. And I think that context is really key, because that point about being targeted interventions to bring about change, you have to understand the population as it is. Yeah, I've got about 20 seconds left before my time's up, so I'm just gonna try and wrap up here. Another case study I wanted to mention, which is a large-scale case study in America, in Denver, was called Mariposa, and that was we might call a regeneration project. So looking at, like Barton Park, which was kind of an expansion of an area, Mariposa was looking at existing community which would be labelled deprived, and looked at some of the potential improvements that could take place in the community. And again, it tried to think about designing beyond physical changes through lots of community health initiatives, and they developed their own healthy living tool, again to try and assess and understand what difference some of these practitioners, some of these interventions would make. And around the table at the start, like Barton Park had its logic model, they sat down and with academics, with practitioners, and with the community to again think about what change was needed and making sure that change was relevant and was appropriate for the communities. So that inclusive process was really, really strong as well. And lots of the changes were around the public realm, as well as some changes in houses, but actually the public realm, to try and encourage walkability, to try and make the streets feel safer for walking around, and try and change attitudes about that community. And because they evaluated it, they could see what changes had resulted. So there was perceived view that residents saying that the health had improved, so 38% of residents said that. They also monitored things like, I guess, unhealthy behaviours like smoking, and smoking rates had dropped, access to open space, and there was a large issue around crime and safety in that community. So they looked at that as part of some of the interventions, and recorded that the crime rate dropped. But also other, I guess, unintended benefits come from residents saying they know how to navigate and they would use the health system. There were other indicators they looked at in terms of demand on primary health care and use of emergency services, and they looked at changes around access to different food outlets as well. So that was Mariposa. Another one scale, like a housing development we looked at, and we spoke to some of the key decision makers involved, was Nightingale 1, and that was a really interesting case study in terms of the development was led by Breathe Architecture, and they had created a really high environmental sustainability and healthy development called the Commons. And this is before they did Nightingale 1. But what they found with the Commons is they created lots of technical solutions to sustainability issues, really high-end housing. But they noticed actually that their reflection from doing that process was actually it wasn't equitable. The development that they created with the Commons led to the fact that health and sustainability was only for people that could really afford it. So for their next project, which was Nightingale 1, they wanted to take some of the learning from the Commons and think about affordability and how could they make an affordable residence that has still those principles around sustainable design and principles for health. So they pushed that as much as they could within development. Move on. and there's another example there, which was an office block, but I'm going to move on and talk about actually some of the challenges. So when we spoke to the professionals involved in these case studies, some of the challenges of starting off with that ambition of trying to integrate sustainability, health and well-being, some of the challenges that they encountered for doing that. And Helen and I wrote up this research, and again, if you were interested, I can send that paper. And I guess the big one was around the risk that these things don't work. And I guess that was counterbalanced by the idea of taking pilot projects, looking at seeing these things as experiments, or like Breathe Architecture did, in terms of seeing themselves on a learning journey of how they could achieve this. But the initial thing was actually taking that leap of that risk, and actually somewhere along the line somebody was taking a risk, either the investor or the developer for these kind of projects. The other things we found was a challenge was about having knowledge gaps amongst the professionals involved in these projects, and the most successful ones were that did bring that diversity of professions around the table, or involved, I guess, had that long process of working towards a common ambition and working together about how they might achieve that. I guess another thing to pull out was around quantifying the value of, I guess, taking the risk around achieving a healthy development. And so we found that developing a business case for these kind of projects was really, really key to try and talk about the value that might not be a short-term value, that's more of a longer-term value that comes down the line with these kind of projects. And so that business case, many of the built environment professionals involved in these projects talked about that element. Even they might have been a lighting designer on a particular project, but they talked about the need to make the case for taking those risks, from taking maybe longer timelines for things. But the business case was really, really important. And that we looked at how actually there was a bit of different mindsets between, I guess, short-term return on many of these projects against thinking about that longer term outcome that comes down the line. So I guess counterbalancing that is what helps to integrate health and well-being into any new development, be it a housing block or be it a neighbourhood, is getting in ready early in that design process, so health can be there at the start, thinking about that business case. And some people spoke about actually there's more demand for these kind of places to live, or more demand from offices of having healthy spaces to increase productivity. The other thing is about having a framework. People spoke about actually there's a need to a framework to try and integrate these different ideas, so things don't get dropped and lost down the line, which takes me nicely on to back to the Thrive framework, because it came out of some of this research, and how we found that actually going back to research, these frameworks can be really helpful to build shared understanding, to actually use as assessment tool, so actually drilling into some of these factors in more detail, and to support the engagement of wider forms of knowledge and participation. So having discussions around what some of those factors mean for different people. So what's the lived experience of noise in a particular area, or ideas around green space and what makes a quality green space. And so what we felt that Thrives could do is also be such a conceptual framework that can be adapted for particular needs and particular projects. So the project that we looked at actually in South London that had a healthy ambition talks about using Thrives very much as a strategy tool to get people around that table for that business case, so at the early stages of development. So I think, like, again, circling back to the resurgence of policy and ideas around achieving health and well-being in neighbourhoods and cities, I think it's in there, the ideas are in there, but I think the still question for us is how can we ensure that that actually truly embedded and these projects are impactful and those ideas don't get lost in the delivery of these programs. So that's it from me, and I'm sorry I overran a bit, but yeah, if you have any questions you can ask now, or please get in touch afterwards. I think I've stopped sharing. Yes.
Yeah, stop sharing. Thanks a lot, Gemma. That's really interesting. I know my brain's whirring with lots of stuff going through now. I can see we've got a hand up from Lloyd. Do you want to ask the question first or comment?
Thank you, Hannah, and thank you, Gemma, for your presentation. It's very interesting. I actually have a couple of questions, if I may be so cheeky as to ask them all. I couldn't quite make out some of the slides, so I'm looking forward to seeing them in closer detail, especially the Thrive slide. I couldn't read all the print there, but regarding urban flight, and I think during the pandemic, I think correct me if I'm wrong, but I think we've seen a slight increase in urban flight. I know so many people who have moved out of London or are looking to move out of London. And now we've got working from home being a viable option for most businesses now. So I'm wondering how all of that factors in, because I know that localism is something that maybe I don't know if that's the right term here, but localism, and by that I mean people are going to more local restaurants and they're shopping locally. They're not looking to commute like they once did to for entertainment, for work, for shopping and all of that. So again, I'm wondering how all of that factors in to what you've proposed today, or what you've shed light on today.
Yeah, that's a really good question, and I think you're right. I think so that slide at the start that talks about urbanization increasing, and I think urbanization is increasing, and still more people will live in cities. But as you say, there has been a shift because of the pandemic, and I think you're right. So around when I started my PhD a long time ago, there was a professor in Oxford that talks about the compact city, and talks about that aspect of and to achieve sustainability in neighbourhoods. He argues that there should be, I think at the time it was like a 20-minute radius, so you should have those amenities linked near where you are to encourage active travel, to reduce car dependency, etc., etc. And that idea has come back. That has come back again, as you say, because I think linked to the pandemic. And so now people talk about the 15-minute. It's got shorter. 15-minute neighbourhood. But I know again, there's been debates in the department in the Bartlett about, well, is that inclusive? Is that what's 15 minutes for me might be 50 different 15 minutes to you? But the core concept is there, which I think you're right, is about having things local, like taking that scale back to local. But I still think we need to think about those impacts wider. That aspect of Thrives that I think is really important is thinking the broader impacts, because I guess the other thing that the pandemic has shown us is that we are all connected, like that it's been a global pandemic, and so there can be knocks in the global ecosystem that will affect our local aspects. It might be like products that we get if there's a change in consumption systems. So I still think that applies. Like we still have to think about that scale, that impact scale. I'm not sure that answers your question, but I think you're right. I think there's probably has been a bit of a change about thinking about urban living and what that means. But yeah, anecdotally similar. I've had lots of friends who leave the city, want a garden, looking for other things. With those shifts around being able to work online or work in a completely different location to where their office actually is.
Definitely food for thought there, Gemma. Thank you so much.
Thank you. Do we have any other questions either in the chat or anyone wants to put their hands up? I have, I guess, a few kind of reflections / questions. One of them that I think I was going to ask about, Gemma, was in terms of the way that this is approached. What have you seen? You've kind of actually answered this. I noted it down before, but around kind of bottom up versus like top down approaches to being able to do these things. But I know on one of the last slides you put in around kind of community participation, how important that is.
Yeah.
Which I think, yeah, not really a question, but a bit of a reflection on that. I don't know.
Yeah, and I do. I think poor Matthew will hear me bang on about that, and I do think that is a real factor about what success of some of these initiatives, particularly those initiatives I've looked at that are more master planning or large scale development that have residents. So I do think there's real value of investing in participation and bringing in different knowledges, and there's some great examples of that. And I think also working with, so I've just been involved in a book with some colleagues that's about co-designing infrastructure. So that co-design process has been really, really important. And one of the case studies in that is a project it was led by a colleague here at UCL, which looked around Somerstown. And I know Hannah and I spoke about Somerstown before, but actually looked about how the community challenged some of the air quality data that lots of decisions was being made on with HS2. And so that case study is really interesting because the data that was being presented to make decisions didn't accurately reflect the locals' experiences of air quality. And they worked with my colleague here, Professor Sarah Bell, and a team to think about, well, where was that discrepancy? And they ended up actually changing some of the air quality that was measured, because that's the value of that local knowledge, of that lived experience that can't be neglected from some of these decisions. And I do think some of those, like in the Furrows framework, some of those things about green spaces, like you can have a debate about what is quality green space for you, me, and I think you have to have spaces. Like having those conversations is really, really important. It's definitely not easy, but it's really important. And sometimes you might not reach consensus, but you want transparency about acknowledging there's different viewpoints in that, and just having that space where you can do that, I think is really, really key. But it can be messy.
Yeah, I think that's something that definitely resonates with a lot of us here. There's a lot of people I can see in the call from the Lancaster West neighbourhood team, and obviously kind of key to our refurbishment programme is that co-design piece. So yeah, definitely resonates a lot. And Somerstown as well, I think from my like what I've seen, there's lots of great stuff happening there, and I do think definitely a lot of that does seem to be around how kind of active like members of the community are and how involved they are in a lot of the work and working with the council there. So I think that's a really positive one as well.
So I guess I summarised it in about 2 minutes there, but that is years of experience. That's the thing, it's such a long process. So that's the thing about some of those projects that have that engagement in it, and meaningful engagement around the table of making those decisions. It can take time and it can feel difficult. Obviously, I think it should be uncomfortable, but they kind of get glossed as saying this is a good thing to do. But there can be winners, like people talk about this, like winners and losers in that process as well, because ultimately you will make a decision that might have a negative impact on certain elements of that community or might go against certain people's viewpoints. But yeah, that project, that case study with Somerstown and the air quality project, that was a good few years of campaigning about aspects about environmental justice, bringing in academics, doing their own study and making sure they had that voice around the table.
Yeah, I think it's definitely a really important area to be thinking about in this. I think I could ask loads more questions, but see, we've got some more hands up now. I think it's Leslie first, if you want to ask your question. If you're speaking, Leslie, you're on mute.
Oh,
No.
hello. Sorry. I'm trying to do 3 things at once here. Sorry, I didn't get my hand up in time earlier. Thank you for that. That was really interesting. I just wanted to make a general comment. I did a master's at the London School of Hygiene nearly 30 years ago on exactly we came up with all of these things. And it's kind of depressing to me that 30 years on, nothing much has changed, where, you know, people like you are sort of doing this excellent research, and there are some projects, but it's quite sad, isn't it, that 30 years on, actually overall nothing much has changed. I mean, we were looking at Dutch and German projects 30 years ago. I don't know if you're aware of something called Agenda 21, which sort of faded away. Nothing took off from that. I work in Housing, Health and Disability team in RBKC, and we fight every day to get the planners to listen to us, and that's just on basic requirements, not even all the wonderful environmental issues. So I was doing environmental epidemiology, and I'm really depressed that it repeats itself and nothing very cohesive ever seems to happen. And I sort of wonder how much your colleagues and you might be able to work on progressive governments. You know, there's a lot of hot air, isn't there, politically, and it just seems that it's this constant strive to get the obvious done.
Yeah, so I think
So
no,
I
so
don't mean
good,
to
that's
be
good.
depressing, but I'm
It's
getting
fine.
old and I'm depressed.
Yeah, I think that resonates with me. So I put in Agenda 21 on one of those slides about like ideas of where health has been included, because it's not a new thing, as you say, but there has been this more explicit focus on it. And I think my first job from uni was working on a local Agenda 21 grant, like money was given for community projects. But you're right, they sort of those kind of things fizzle away and then it comes back again. But there are lots of good case studies out there, and we have this conversation at work, like we need rapid change, we need large scale rapid change, but what we see is kind of niche projects that take a while to change the system. And there's been, okay, not to go back to academic, there's been some nice research about how the niche can change the system, but you need changes in, I should say, political, you need changes in finance systems for that to happen, for wider systems to change. And I guess out of the case studies that we looked at, there was a great network. Sorry, I'm in a room that turns off if I don't move. But the great network where in Australia, which had been by those, as you say, they'd found like-minded planners and health professionals working together, and it kind of organically emerged where you found people, I guess, like you, stayed working, had that knowledge, and had carried on working in that field, and it had grown and grown. So some of the projects we looked at in Australia, you could see that evolution where people had the learning based on their experiences. But yeah, I do agree with you. Like, how can we is a big challenge. How can we take these niche case studies and make sure it leads to wider systemic change? Yeah, it's a good question.
Thanks. Okay.
Hi, so I just wanted to comment and maybe add a little bit of a positive note. I'm a landscape architect and I just recently joined the team, and I have to say that I've seen a change. I've seen a change in attitude. I've seen new projects come up, new ideas. I've seen how people are excited about open spaces, making changes, adding value. So landscape all of a sudden has this great possibility to add value and to have these great benefits, not only for health and well-being, but also for the environment overall. So I would just say that I think the research you've done, it's amazing. The seed is planted, the seed has been planted, sorry, and I do think that we have, things are happening. And yeah, thank you for such an interesting presentation, and I certainly would like to see a copy of that paper if you can
Yeah, sure.
make that available.
Yeah, thanks, Vanessa. That's really nice because obviously it's slightly, a lot of my work, I'm still in the research world, but I fall into practice, as I mentioned. So it's nice to know that there is that enthusiasm and energy there to bring about change, because that is where these projects and case studies that we looked at, like people were taking those risks, people were around the table and they wanted to change the system, but it's like, where's your spheres of control? Where can you control those changes? But it's people like yourself that are willing to push and shift those attitudes. So that's great.
Yes.
So thank you. Yeah, I can share the papers and I'll send them to Hannah and Matthew and they'll be happy to circulate. And any questions throughout, I can put you in touch with Helen that created the framework and other colleagues at UCL. More than happy to.
Amazing. Thanks.
Nice positive end. Thank you, Vanessa. But yeah, thanks again, Gemma, for today. I think it's been really interesting, and I'm sure that I'll definitely be in touch soon about a few things that would be good to chat about. And yeah, I've got the slides, and if you send over anything extra, it'd be good for us to send round. I'll make sure that we send this round. We'll also put the recording of this online as well for anyone that missed parts of it or anybody else that wasn't able to attend. But yeah, thanks again, Gemma, and thanks everybody for coming. Out of time now, but if anybody does have any questions, then I'm sure I can send them over your way.
Thanks for coming. Lovely to meet you all virtually. But yeah, get in touch. Get in touch. Yeah. Okay. Bye.
Thank you. Bye.